Some skin cancers may appear as red dot or a patch of skin that is irritated. Any part of the body that is exposed to ultraviolet UV radiation has the possibility of getting skin cancer. About 90% of non-melanoma skin cancer is associated with ultraviolet radiation. Reine Théophile Hyacinthe Leonek, a French physicist, the inventor of stethoscope, also discovered skin cancer. Skin cancer was discovered as long ago as the early 1800s. Skin cancer has many types, but the most common are non-melanoma and melanoma. Keratoacanthoma, lymphoma, and Kaposi sarcoma are also some common ones. Skin cancer is a type of cancer that can come from UV radiations or by genetics. Skin cancer can be genetic just by this form from the pigment producing cells in the skin. When having such traumatic thing happening to one's body, it can take a toll such as social, physical, and financial burdens on both individuals and societies. When getting skin cancer, you have the choice of how to take it off, and when choosing the way of surgical excision, it can have disadvantages like infections, nerve and tissue damage, scarring and bruising, and most importantly, the risk of incompletely excised tumor tissue. There is also advantages of surgical excision such as the low cost and the inability to easily determine through subsequent histopathology whenever tumor-free margins have been established, providing patients with the confidence that his treatment has been sufficient. When a sample has been removed from someone's body, it is then transferred to a lab, and a pathologist then determines if it is skin cancer or not. Most people say that they just had a little irritation, nothing huge, and it was skin cancer, but others say it really bothered them. Usually people just think it's a mole, and I don't think nothing of it, but after a while it ends up bothering them. Most people that find out they have skin cancer usually don't have to live long with it. Recurrence can happen many times, but the doctors take it off as soon as possible. Genetic engineers now can arm normal white blood cells with the tools that let them weed out cancer cells and shrink large tumors. Researchers in a National Institute study had success using the technique to treat skin cancer in two men. Continual research today at Bispebjerg Hospital is still being tested to find new gene therapy for the future. Something that I've personally encountered is that my grandmother has had multiple occasion pop-ups.